grades are you guys allowed to do? Okay, so is that going into resistance or not going into resistance? Not going into resistance, right? One of the first things that I like to do in determining what grade mobilization that I apply is finding my resistance point. So I'm gonna distract and I'm gonna push until I feel that R1. I don't know if you talked about R1, but that resistance. So for grades 1 and 2, I'm gonna come and I'm going to, let's see, get my patient's arm on the outside usually so that I can distract here. And then I will put my hand over top of the humeral head and I'm gonna push to find that resistance point. So for her, you know, end range, I can go all the way down. For grade 3 and 4, I have to go all the way down, right? I can get about 50% of that way before I hit that R1 as I'm doing this. So when you guys feel that R1, that's the end of your grade 1 and 2 mobilizations. Grade 1s are gonna be very light up at the top of that non-resisted range. Those are small amplitude, right? Let me check my body mechanics real quick.
You're cool with that. I told him they could.
Yeah, that's
okay.
fine. Well,
No.
if I'm doing an anterior to posterior mobilization, supine makes the most sense, but what makes the most sense if I'm doing a posterior to anterior mobilization? Right, and so it's gonna come down to patient tolerance and what position they can get into. Some patients, whether it's preference or actual contraindications, can't get into prone, and so we've got to remember that. But for what works for the mobilization, think about the position that you have to push into and try to consider that first, and then think about patient specific.